Which of the following cellular type is not seen in case of this sarcoidosis? So the sarcoidosis is a chronic inflammatory condition of our body, and there are present different type of the cell, among them which is not a feature of the sarcoidosis. Here the options are the red Sternberg cell, T lymphocyte, macrophage, asteroid body, and B lymphocyte. So which is not present in case of the sarcoidosis? First of all, let's see the Hodgkin lymphoma. In case of the Hodgkin lymphoma, what occurs in case of the Hodgkin lymphoma? There is the RS cell, that means the red Sternberg cell. Normally here we can see there is no such type of the cell in this microscopic view, but in the second option here we can see this is the RS cell or red Sternberg cell, and it is the pathological feature for the Hodgkin lymphoma. So in case of the Hodgkin lymphoma, RS cell usually present. So the RS cell or red Sternberg cell are especially seen in case of the Hodgkin disease. And all option usually seen in case of the sarcoidosis. So let's see details about the sarcoidosis. So what is this sarcoidosis? The sarcoidosis actually it is the chronic inflammatory condition. It is the chronic inflammatory condition, granulomatous condition, and it involves in different part of our body, and the pulmonary involvement is most of the time, that is more than 90% of the case, but it can involve other area of our body. So here we can see the histopathology. In case of the histopathology, there is the non-caseating granuloma. That means there is the granuloma but non-caseating, and also there is the epithelioid cell. So epithelioid cell present. Actually, in case of any type of granulomatous condition, there is chronic condition. There is the lymphocyte and macrophage present. So lymphocyte and macrophage. Usually they present in case of the chronic condition. So in chronic condition, the lymphocyte and the macrophage, they are usually present in the wound area. And in case of the pulmonary sites, there is the bilateral hilar lymphadenopathy, and also there is the pulmonary hypertension develop. And other area it includes, such as it may causes the polyarthritis, erythema nodosum, anterior uveitis, hilar adenopathy, parotid or salivary swelling, facial nerve paralysis, anterior uveitis, and low-grade fever. So the sarcoidosis, it mainly involve the lungs, but it can also involve the salivary gland. It can also involve the vessels, skin also. And in the sarcoidosis, there is the chronic inflammatory cell, which is the lymphocyte, macrophage, and modified form of macrophage, such as the epithelial cell, giant cell. They are present in the wound area of this sarcoidosis. And in the case of the sarcoidosis, there is the special type of the cell present, which is known as the asteroid body. That means this cell, it's shaped like a star, and it is known as the asteroid body. Here we can see this area usually it's shaped like a star, and from there this is the asteroid body, and they are commonly seen in case of the sarcoidosis. So which is not a feature of the sarcoidosis? It is the RS cell or red Sternberg cell, because the RS cell or red Sternberg cell, it is the pathochromic feature for the Hodgkin lymphoma. Other option here, such as the T lymphocyte, macrophage, and B lymphocyte. The lymphocyte macrophage, they present all type of the chronic granulomatous inflammatory lesion. So any type of the chronic lesion, look for their lymphocyte, look for their monocyte. And also the asteroid body is specific for the sarcoidosis. So which is not true in this option, that means which is not found in case of the sarcoidosis, it is the RS cell or red Sternberg